Okay, so for our beautiful lady here, we're gonna do Botox. We did a few months ago, so we'll do again. So if you're gonna mark for anything in the three areas, Botox mainly honestly the forehead. So lift your eyebrows up, 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 up. Okay, so here we'll mark here. You see the frontalis muscle, you don't have muscle here, so we'll do one and one here, and then you see there's nothing lateral to this side, so there's no point injecting anything there. And then we'll stay a little high, and then maybe here, okay, and then maybe in the middle here we'll inject the same side. Here we don't have any muscle movement, tiny bit there. And this side, she told me that it's droop a little bit more, so we're gonna inject either less units here or a little higher compared to this side, so make both sides symmetrical. So again, I mean, the other areas more or less you don't need. At the beginning you can mark everything. I don't even sometimes ask the patient to frown, give mad face, because if you do this movement here, you can see, you see the muscle 1, 2, 3, 4, 5, so you can just go there and inject these muscles. As I go from the corrugator to the procedure, corrugator like almost 90 degrees, and the procedure the head almost 45 degrees, and then for the tail I would do like maybe 10 to 15 degrees. You have to be superficial there so that you don't cause eyelid ptosis because of the supraorbital foramen here, that the medication can, if you are deep, then you can see from there and go to the eyelid. The other thing, you know, there's the supratrochlear, there's the arteries there as well. Sometimes patients bleed when you inject there, so be careful. If that happens, it's okay, just apply a little pressure into that area. Okay, but if you're doing filler, you have to be way more careful in that area. Okay, here the same thing, you know, even without asking the patient to squint on anything, you can see a little static line, so we can follow that, because if I ask her squint a little bit, okay, it's the same thing. Okay, relax. So you could see that it's the same areas where you have the static lines where we need to inject. So again, a lot of time I just don't ask the patient to animate, because I know that's the areas where anyways I need to inject. Remember, apply blood pressure here. So there's a little vessel here, that's why actually she had a little bit more discomfort. So when you are, actually this is kind of how you know when you're injecting Botox, if the areas that are more vascular or in a vessel, that's a little bit more painful than other areas. So we apply a little pressure here. Okay, so we're here again. I injected the crow's feet in the side the same, and then we'll go the most important, honestly, and the area that it needs the most skill for the injector is the forehead area, because you know, injecting too much, injecting too little, the location, the strategy, the depth, everything make a difference in the final outcome. Especially people, they love their eyebrows and how they look and where they situated, so you don't want to mess with that, so you want to make it the same or improve it, you know. And that's what makes a difference where you're the skill wise between one injector and another when it comes to the forehead area. The other areas, of course, you need skill, not to cause any problems as well, but again, it's not as critical as the forehead area. So train yourself the best again in the forehead. So when it comes to the, again, the forehead on this side, the eyebrow is a little bit higher, so it's okay. Where we marked, we're gonna inject 2 here and a little bit 2 here. We're almost done, we're almost done. And you can see always a little bit of drops, although they're very, very few units. I always try to collect them and re-inject them so that we inject the whole amount and we don't waste anything on the skin, because we're always gonna squirt a little bit outside, so we aspirate them. So again, this side is we put the dot, so I'm gonna go a little higher. That will make a big difference actually, to get less of a pressure on the eyebrow on this side, and we match the right side by doing this. And you know, we have a little bit left, we inject it here and we're done. No more needles.
Yay!